Hi everyone, this is Nitin Choda and welcome to this special training video on EMRnews.com where you can get the simplest, the fastest advice for the successful implementation of an EMR system in your practice. Now there are three stages to the successful implementation of an EMR. The first is assessing the advantages of an EMR system for your practice. In my opinion, an EMR system has more advantages than disadvantages. The second is obviously considering the costs of the different EMR systems out there. And the third, and the most important, is the implementation of the EMR solution in your practice. Now, as far as the advantages of an EMR system are concerned, you can save time and money because you're simply entering patients' information into an electronic medical record which can be accessed from anywhere. You're saving staff overhead, you're saving on the time and the lack of effectiveness of simply using paper records. You're gathering valuable business intelligence. You're able to, at the click of a button, analyze where the patient came from, what they're looking for, how quickly they're improving, how to stay in touch with them is a big factor, how to be able to serve them better. You'll be able to analyze a wealth of data inside an electronic medical record system. Now, there are server-based EMRs, there are web-based EMRs, and each one of them have their advantages and disadvantages. But in my opinion, the biggest advantage that an EMR system should have is portability. Making sure that the EMR system is easy and mobile so that clinicians, physicians, physical therapists can access it on the fly. It's extremely important to be able to access an EMR from a tablet-based device because that is the future of EMR. That is where EMR is heading. Now, the second factor in the successful implementation of an EMR that you do need to consider in your practice is the cost of an EMR solution. Most EMR solutions have some sort of a setup fee. They have a licensing fee. There's a monthly fee involved. A lot of EMR systems start off by being fairly inexpensive, but then the costs tend to add up because there's a cost to upgrade this and cost to upgrade that. So make sure you do your research and you find out all the little costs involved in everything from the appointment reminders to the extra billing module. If you're a physical therapist, the cost for a home exercise program. And find out exactly what you're paying for so you know exactly what your total costs of an EMR solution are. Obviously, you want to keep your costs of an EMR solution as low as possible, but keep in mind the projected cost savings of using an EMR solution for your practice versus not using one are quite significant. In fact, the government, the federal government, has mandated the use of EMRs for physicians and hospitals, and it's likely that that may happen for other professions as well going forward. So there's the, I mentioned two components of an EMR, and now the third component of an EMR is a successful implementation of an EMR. Now, a lot of times clinicians get stuck in the research stage. Should we do it? Should we do it? Should we do it? You need to be able to phase yourself into an EMR solution. You can't just have all your patients in an EMR immediately. You need to start doing proceeding with the integration of an EMR one patient at a time. So let's say you decide to use an EMR solution, start using it for a few patients in week 1, and then increase the number of patients that you're documenting using the EMR in week 2, and then go on from there. So make sure you proceed with the integration, the implementation of an EMR, but you do it in a phased manner, what I like to call phased implementation of an EMR solution. So there you have it, 3 factors associated in the successful implementation of an EMR solution. Make sure you keep an eye on the advantages of an EMR, which is the first factor, the cost of an EMR solution, and most importantly, implement and integrate the EMR solution as opposed to just holding off on it, because the advantages far outweigh the disadvantages. Thank you so much for watching, and make sure you keep coming back to EMRnews.com if you need any information about EMR, the pros and cons, any information related to EMR, healthcare practice management, and referral generation. My name is Nitin Choda from EMRnews.com. Thank you so much for watching, and I'll see you soon.